Hi everyone, thanks for having us. So I just want to talk to you today about this project that we've been working on with Dr. Dhesi, and that's pre-hospital thrombolytics at RIH. So as many of you probably know, thrombolytics are one of the mainstays of treatment for people having heart attacks outside of areas that have cath labs in BC. So these are medications that basically break down a clot when you're having a heart attack. And just like when you're having a stroke, where they say time is brain, with a STEMI, time is myocardium. So we know that the sooner that we can give these medications, the better that our patients can do. And we're going to prevent significant morbidity and mortality if we can reduce these times. Unfortunately, RAH wasn't meeting these times that are set out by the Canadian Cardiovascular Society. And there's a few factors that play into this, but much of this is due to the geography of Canada, the fact that in BC our communities are spread out and there's long transport times from the time that the patient has the onset of the symptoms to the time that they get to the treatment center. So the idea of the project is, if it takes a long time to get the patient to the treatment, why don't we instead bring the treatment to the patient? And so our project surrounds having ambulances being able to give thrombolytics on the way to the hospital for these patients. So where our project stands now, we've developed a curriculum to train a number of the advanced care paramedics in Kamloops to be able to recognize STEMIs and to be able to administer these thrombolytics. And this is, we've also developed a infrastructure so that the paramedics can communicate and liaison with the cardiologists on call in Kamloops. So the cardiologist can confirm, yes, this is a STEMI, and give the go-ahead to administer the medications. So we'll be delivering the curriculum to these paramedics later next month. And the hope is that we are going to be giving the first ever in BC in the field thrombolytics by the end of this summer. So we're excited about that.
So the goals for our project right now is a 30% reduction in fibrinolysis time, and the hope for that is that that will result in a reduction in length of stay after a STEMI. And our overall aim for our project is to have at least 80% pre-hospital identification of ST elevation MIs in the field, with hopes for administration of pre-hospital thrombolytics ideally within 2 hours between symptom onset to needle time, but ideally less than an hour. I just wanted to chat quickly about some of the challenges that we are experiencing in our project. One of our major barriers to starting this project was medication acquisition for BCEHS. And the reason for this is because TNK, or the thrombolytic that we're using, is quite costly. It's about $3,000 a vial, and it also has an expiration date. So one of the things that we were hoping that we could do is to get the hospital pharmacy to actually supply kind of a STEMI kit that could be given to the ambulance crew that they'll take out, either use or return prior to the expiration date, and it can then be used in the hospital, where kind of there's a quicker turnaround of TNK use in the hospital compared to an individual ambulance. We were originally having a bit of challenges surrounding this, acquiring this medication, due to the fact that it's $3,000 a vial, and then we weren't sure if RAH was going to be able to fund this. But today we just found out that it sounds like we'll likely actually be able to get this medication through the RAH pharmacy, and our hope is that we'll be starting our first kind of PDSA cycle of this project in early August. Other minor barriers to our project so far has just been ECG transmission from in the field to the on-call cardiologist, but it seems like we'll be using Stryker LifePack to actually do this, and it's going to be able to send the ECG through a secure connection. And finally, just that creating a system of timely communication between the field and the actual on-call cardiologist. We've set up a very specific kind of paging system through the hospital network that will then be able to page the on-call cardiologist so that they know that they actually have a stat page that they have to respond to quickly rather than slowly. Overall, our vision for this project is that RAH is going to be a pioneering hospital for pre-hospital thrombolysis in BC, with the hopes that we can actually expand this to other communities within BC in the future, particularly those rural communities. Thanks so much for having us.